And good evening. Welcome to the 1460th day of continuous and uninterrupted Zoom set of IFPH. Let us start today's program with a silent prayer for 1 minute. Thank you and welcome back. Today we have with us Dr. Bindu B.R. He's the Center Head, Vidyadharaja Neurodevelopmental Center, Kerala, Trivandrum, and she's also the lecturer, Department of Homeopathy Philosophy, Sri Vidyadharaja Homeopathy Medical College, Trivandrum, and a lot of experience. And the topic is the neurodevelopmental scope of homeopathy in cerebral palsy and learning disabilities. They developed a neurodevelopmental center at the college as well as sensory park. It's very interesting and important one. They are doing well. Tremendous job, commendable job done by Dr. Bindu. So on behalf of IFPH and Dr. Bindu, you can have the platform for next 40 minutes. It's over to you.
Sir, is the screen visible now?
Yes, of course.
So, good evening all. So this is the second part. Actually, we were talking about the sensory integration and scope of homeopathy in neurodevelopmental disorders. Last session, we have discussed about the autism spectrum disorders and sensory integration in common. So today, we will be dealing with cerebral palsy and learning disabilities. Those are the two other two among the other neurodevelopmental disorders. So let us begin with the signs of neurodevelopmental disorders. This is a repetitive thing because it has that much importance in our life. So you have to be, the first sign will be motor and language development and temperament in the first 3 years of life should be investigated to detect the neurodevelopmental disorders. We have to be careful when the child, after the child is born, up to 3 years, we have to watch the child carefully to know whether there is any motor or language impairment and temperament like that. Like every month, there will be some or other changes in the infant. So, for example, in when a 2-month-old child, the infant should, the baby should look at our face and start smiling. So that is the first indication, like social smile. If it is lacking, we have to be careful. Similarly, each and every month, we have to go through the developmental milestones. We have to be very thorough about the milestones that the child should achieve in all the first 3 years of life. And repetitive and stereotyped behaviors or any atypicalities or delays in play and in first 2 years of life. Similarly, attention, visual and sensory processing that we discussed earlier. And coming to the cerebral palsy and all, especially we should see whether there is any difficulty in feeding or sleeping patterns. So these cerebral palsy is more of physical disabilities than the mental disability, like in the psychological plane or comprehension plane. There may be difficulty in comprehension and all the other features, but the more will be focused on the physical plane. So early signs of cerebral palsy or CP is the main sign is child having a delay in reaching motor or movement development, such as rolling over, sitting. When the child or the infant reaches 4 months of age, we know that within 4 months, the infant should roll over. That is, and if it is not achieving at the 4th month, we have to be careful. Like that, sitting should be achieved in first 6 months of age, at least with support. If it is not there, then again, that is a warning sign. In a different age group, what are the things we have to be careful of, or we have to look upon, whether to know whether our child is having CP or not? When the child is younger than 6 months of age, we should see whether these signs are there. That is, the head lags when you pick him up or while lying on his back. When we take the child in our arm, the head will lag. Usually when the when there is when the child takes, usually the child should take the head along with the body. If it is not coming along with the body, and if it falls back, then there is a lag, we should suspect. Or otherwise also, if he is stiff, he is keeping his limbs stiff, then also that is a warning sign. Or floppy means very loosely hanging the limbs and all. And also when the child is cradled in your arms, if he seems to overextend his back or neck or some like opistotonous position and all, as if the child is pushing away from you. And another thing is that when you pick him up, if the legs get stiff or become scissors like or crows like this, then we have to be careful. Similarly, when the child is, when the child is over than 6 months of age, and still the child is not rolling over, or and if the child cannot bring her hands together, like when we show the hands and the infant doesn't comes to us, or showing its both hands together and all, there is something with the physical, the baby is having some physical disability. And another thing is that if the child has difficulty in bringing her hands to the mouth and all, and also the one hand is stretched and one hand is fisted, and then there is some rigidity, or the other may be floppy if the child cannot raise the arm also. Similarly, after 10 months of age, if he crawls in lopsided manner, that is one-sided or leaning towards one side, that is lopsided manner. If the child crawls like with one side, then that is a sign. And pushing off with one hand and leg, while drawing the other in the opposite direction, or scoots on his buttocks or hops on his knees and all. These are the signs. Now coming to the cases, let us discuss. I think it is clear. So the thing is that we have to be careful when thinking of CP or cerebral palsy. The physical disabilities are more like before the 6 months, what all we have to see after the 6 months of age, and then after 10 months of age, like 1.5 years to 2 years. That time, what all the things we have to expect if that is a case of CP. If any such sign comes, please refer the child to a neurologist and make sure that it is a cerebral palsy. And there may be some or other features in the mental aspect, that is comprehension level also, but it is not always that compulsory to have a comprehension difficulty. More of physical disability in case of cerebral palsy. So let us discuss the case. Like I have selected 3 cases from cerebral palsy and 2 cases from learning disability. This is the case 1. This is in Malayalam. I will explain after playing that. The child was affected with repetitive, uncontrollable movements. The child usually shakes her body and the head and all. She cannot, the parents cannot make her sit and all.
It's not audible.
It's not.
Share audio, I think this is an option.
Audio കേൾക്കാൻ പറ്റുന്നില്ലേ?
No, ഇല്ലല്ല.
ഇപ്പോഴോ?
No. I think there is an option, share with audio, isn't it?
So I will explain that the child has difficulty to, even after like reaching 3 to 4 years, there was difficulty. 3 years, the child, the parents find it difficult to make her sit. She has uncontrollable movements, and she cannot hold her head straight and all. There was difficulty in comprehension also. So we'll show the video later, like after. This is like 4.5, or I will show the video and we will go to the case. This is after improvement only. I have taken this, even after one, like, or 6 months, more than 6 months of treatment only, I have taken this video. See, she cannot sit properly, even she's leaning forward and her head is shaking with the body and all. But she started comprehending, that is why she is responding to the mother. So after our medication only, this change came, and see, now she can sit with small support. She holds her head like this, and now she responds very nicely. Whenever she is taken to the clinic, she gives like flying kiss and all. So she has improved with the coordination and all, and the repetitive movements has reduced. It's not completely gone, but it is reduced. And the case, the child is 4.5-year-old female and born to a non-consanguineous parents. So that is the usual history we take, like in the whether we will ask that whether the child is born for first level cousins or whether the parents are relative and all. And so as usually like non-consanguineous parents and diagnosed with mixed CP, cerebral palsy is of mixed cerebral palsy. It was diagnosed like that. And the delivery was at 8th month, cesarean due to oligohydramnios. And she was kept in NICU for 13 days and she doesn't sit, no head control, nasal polyp was there, fontanelles was open, and even now it is not completely closed, but still it's better. And there was exophthalmos. Now the eyes almost normal, like you can see in this picture. There is little bit of bulging, but not compared to the normal child. There is some abnormality that we can feel, but it is better than before. And the main symptoms I took was like desire for salt, ice cream, and aversion to covering was there, fanning. And NICU history and first days of lack of care was the important symptom I took, and the hot patient. So by taking that into consideration, gave carcinosin 200 and reached up to 10 m. And along with the medication, I have advice for the physiotherapy. So in case of cerebral palsy, physiotherapy is more important than any other therapy. Along with physiotherapy, we have to give, after some time, if the flaccidity or the rigidity reduce with physiotherapy and our medicine, then slowly we can incorporate occupational therapy to teach them the daily living activities, ADLs. So first, physiotherapy should be advised along with our medication, because our medicine will help the movement to help the physiotherapist to do the physiotherapy properly. The joints may be stiff, or in some cases the muscles may be flappy. So that case, when we give medicine, the physiotherapists usually tell the parents that after medication, it is easy for them to give the therapy, and the joints are more flexible and all. This is the second case. Here also, I don't.
Not audible. Some technical problems I suspect.
Sir, it's
Some
not
sort
at
of-
all audible or reduced.
No, not audible. Some palsy is there, I think, in the system.
Okay. So in this case is a 10-year-old girl, and she had difficulty in walking, and there was like the and she was diagnosed at 8 months. And they started therapy. They diagnosed it at the 8th month of age, and they started therapies, different therapies, especially the physiotherapy and all. But it was very difficult, and she has to be carried. Even due to the gain of weight, also the parents find it very difficult to carry her and travel. Uh, and Now she's better, like the movements are more relaxed, and they are administering. Earlier there was stiffness of the muscle, and it was rigid, so the movements were so difficult. And but after our medicine, after starting our medicine, it was easy. And somewhere, this is the third case, sorry, the second case. In that case, it was very difficult, and I gave the medicine Pulsatilla. Second, let me see. Sorry. It was from Pulsatilla, 200 to 10M were given. And the child show like 60 to 50M. I had confusion because today evening I was little bit busy, and the cases were arranged. So it changed the slides changed. Sorry. So it was Pulsatilla, and 60 started to up to 50M. The main symptoms selected were the desire for pastry, and she was she was changing her mood suddenly. So even in the clinic, when we talk also, the mood change we can observe. That changeable mood and the desire for pastry, it was very high, that she always asked for the pastries and ice cream, desire for ice cream and all. So that made me select the Pulsatilla, and from Pulsatilla 60 was given because there was that case was severe. That one, it was a mixed type of CP also. Some joints were flaccid and some were rigid. So, and at this age, they had a very difficult, and there was, I think there was involved urination was there, and there was seizures on and off. So that is why I selected 6E, and starting with 6E, the dosage was at first 6E 1 hourly in the first day, second day it was 3 hourly, and then made it 4 times a day. Then it tapered to 3 times a day for 2 weeks, and then twice a day, and then changed to 12C. The same dosage was administered, and slowly from that 31 dose, and waited for 2 weeks, then 32nd dose and 200, like that it reached up to 50M. Now she was, with support of the parents, she can walk, and improved a lot. Like seizures, complete absence of seizures. I didn't mention here about the seizures and all. Now there was no seizures, and the involuntary urination was stopped. It's completely stopped, and the physiotherapists can help her a lot because of the flexibility of the joint. So they are continuing with the physiotherapy also. This is the third case where the child, the history was breathlessness during and the first hour later. Like we told that neurodevelopmental disorders, the main causes of the brain damage may be the hypoglycemia or hypoxia, or any hypovolemia, that is blood flow to the brain due to any injury, or maybe due to the birth injury or something. In CP, mostly some delayed labor is there. We know that the oxygen to the brain will be delayed, and hypoglycemia, because when the mother is having diabetes mellitus, the child may have hypoglycemia. So that may be the cause of the brain injury or the dead tissues in the some areas of brain and all. So here there is delayed, the birth was delayed, and there was breathlessness. So the oxygen to the brain was delayed and all. And the breastfeeding, the child has difficulty in sucking the breast, that is breast milk. Breastfeeding was difficult due to that. So he was not given any breast milk. And there was difficulty in focusing the eyes, and squinting is there, and delayed speech, and muscles were rigid, difficult movements, but can sit with the support of only for 15 minutes he can sit with the support. And in generals, the thirst is good, and he was not able to express. The child, recently only the child was brought to me, and we have started with the only reached up to only second dose was given. But even after the first dose, the child showed improvement, because there was very difficulty. Always the child was making noise, and the mother used pacifier, that because it was shrieking and all. The child is shrieking. And there was difficulty in passing urine and all. Sleep was always disturbed, and different position. The mother has to change in different positions to make the child sleep. And but the child loves traveling, and there was desire for sweet. And the medicine was given again is carcinosin 200, and now there is reduced rigidity, so that the mother can take him in his hand and feels, and the child is more active, and the cry has reduced, and now the sleep also has improved. Only the second dose was administered on last Tuesday. After the first dose itself, the child showed improvement. That is the only reason why I took this case also here. And now coming to the learning disability, what are the red flags of learning disability? Is mostly like we will identify the learning disability mostly after third grade only. We can finalize that whether the child is having any learning disability or not. That is formal schooling. Once we begin the formal schooling only, we can confirm that the child is having learning disability. But earlier itself, there is little bit of signs will be there showing the LD, but we can't confirm before the formal schooling begins. The signs will be red flags, or the signs will be difficulty in attention. They can't focus or sit. When we give simple games and all, they can't concentrate or attend it completely. And there will be clumsiness or laziness. We will think that it is because of the laziness they are not studying and all. Maybe because they are finding some difficulty in comprehension or doing the task. They are showing this clumsiness or laziness, and especially in completing the homework and all. And usually when we expect that the task should be finished in half an hour or a small task, but the child is taking 1 hour or 1.5 hours, that is he or she is taking a long time for completing the homework, then we should think something is wrong with the child. And also easy distraction. When we give them some instruction, they won't be paying attention. Like for example, if we tell the child to take a cup of water from the kitchen, the child will walk halfway and then come back and ask that without thinking that without remembering what we have told them. They will come back because of lack of attention to our instructions. So that is a sign. And another thing is that the handwriting will be shabby. They are not giving that much importance. So the handwriting will be not proper, and they cannot keep everything in order. So when we see all the books will be shattered, the books will not be kept in an order, or the pages will not be like clean and tidy and all. So everything will be in out of order for them mostly, and they can't keep a routine in all the tasks. Like when we say that we have to get them ready and all, they will be lazy. We feel that the child is purposefully doing this, but maybe due to some disability. So we have to be, if the child, after giving repeated instructions and all, the child is not doing that or is not able to keep routine and all, just think that there may be some disability with the child. Also in completing simple tasks, like if we say that you should pour some water in a glass from the bottle and all, they may not be able to do or grasp the pen properly or draw a picture properly and all. They can't do even a simple task. It may vary from uh, the learning disability, vary from type to type. They can make simple calculations. Like if we give 1 + 1, what do you mean? Like how much it comes? Like when you take one bead and along with that one more added, how much it will be, and they will be finding difficult to calculate. And difficulty in reading time. They can't tell us the time on looking at the clock and all. So that all points to some learning disability, like confusion of letters B and D, W and M and all, and similarly difficulty in reading and writing, and also forming simple sentences. Also, there will be difficulties. These may be the red flags of learning disability, the first signs of learning disabilities. The first case is dyscalculia. I got one case which is he has difficulty in calculation, simple calculation. That is, he had difficulty in counting numbers from 1 to 100. And then there was jumbling of capital and small letters. When a single word is given, he will write both small letters and capital letters in the single word itself. And also difficulty in comprehension and all. The physical generals, only the thing is that he likes fish. But I have given Staphylococcus agria because the thing is, selection for Staphylococcus agria, the symptom I took was he gets easily disturbed or sad while narrating his complaints to others. It makes him, he takes it as an insult. So after the parent narrates his difficulty, or he is like that, he is not doing math very well, he has finding difficulty in doing math and all, he gets very disturbed easily, and after uh, these things get disturbed, makes him disturbed. So that made me select Staphylococcus agria. Now, like last consultation, when we asked, like we giving one pen and after that giving one more, told, ask him how much it could be. Then he told it is 2. Like after taking one from that 2, then we asked, like now how much it comes. Then he told 1. Like he was able to do single uh, number calculations and all, and he his mother told now he can easily write from 0 to 50, and also that much improvement after the first dose. So that is a new case, and only first after first dose this was the change. And the second case, in this second case, this can be confused, like taken as an ODD and also learning disability, because in this case, the child was only 4.5-year-old, and parents told that he cannot write the numbers continuously, or and she was very reluctant to go to school. Earlier, she was very good in that extracurricular activities as well as in academics. But since 6 months, she was showing no interest in going to school or study and all. Even after punishing or giving her tuition, she was finding difficult to do simple task, and she is not writing. Even when they give some homework, also she is not writing that. So when I inquired into the history, the I asked them whether there is any, like only after, since 6 months she is showing this. Before that she was studying very good, and she was good in extracurricular activities. That is, she used to sing and dance in the school, in the functions and all. But since 6 months, she is reluctant to do all those things. So I asked the parents, like, what is there anything that made her sad, or any event this 6 months ago which disturbed her? Then the mother told that the one of the neighbor abused her, or made fun of her for having bald head and all, when they shaved her head going to a temple and all. So she was very disturbed, and she told that neighbor that don't call her like that, or make fun of her, because she doesn't like and all. But the neighbor again uh, made fun of her, and one day she came to their home and made fun of her in front of the parents and all, this grandparent and mother, grandmother and her mother. And she was very upset, and she shouted back at the neighbor and went to the room. And after that, only these developed. So I gave Staphysagria varnam, thinking that insult as a main course, and she started improving. Like, she started going to school and all, but there was little bit of clumsiness remained. And then again, I retook the case, and the medicine selected, the symptoms were she was chilly and prefers covering, and she was very attached to her mother, because the mother told, if the mother is not with her, or she is going anywhere, leaving her at home, she is very disturbed, and that makes her disturbed and all. When the mother scolds, she gets sad easily than any other members of the family and all. So that made her, that made me think of calcareous, and I started with calcareous 200. Now it reached up to 50 m. She's improved a lot. Now she's participating in all the extracurricular activities along with the studies. So doing better. And like, these are the tools used for assessment is Wechsler's preschool and primary scale of intelligence, and Wechsler's intelligence scale for children up to 6 to 16 years. Even in adults, these scales can be used. These scales are usually used to assess the verbal and performing skills of a person, whether it is a child, or in the child below 6 years or above 6 years, or even in adults. These verbal and performing skills are assessed using the tools. And in children, the comprehension also checked, and also the working memory is checked using the tools. And in general management, it is said that usually the task should be divided into small steps, and help them to do the task, so one by one. If we give a complex instruction, it is difficult for them to comprehend and do. So it should be break in small steps. Like when we teach them alphabets, if the child is learning alphabet only, we have to teach them alphabet by drawing lines, and like slanting line, sleeping line, etc. and across one line across, and all in small steps, like half a circle, like that. Each step is each thing is divided, task is divided into small steps, not a complex instruction they cannot follow. And also administer props means uh, repeatedly we have to ask them to do, and like giving instructions repeatedly, because the attention will be, they will be get in distracted easily. So we have to probe them frequently, and also give a quality feedback, that is positive feedback is always necessary to make them do that they are recognized, because these kids usually have a like inferiority complex, or they feel like they feel that they are not good, or everyone is watching them, they can't do it, they are not good, and all, because all the other children are ahead of them, and also they feel insecure. So we have to give positive feedback in when they achieve even a small a small achievement. We have to give, even in a small achievement, we have to give them positive feedback, and some uh, rewards, or some, especially if in kindergarten and all, even a small smiley sticker is enough to motivate them. So we have to motivate them with rewards and feedback, positive feedbacks, and support with diagrams, graphics, and pictures. Like if they are trying to say about apple, we have to show them the picture of apple, and uh, probe them to speak apple, like that. And graphics, make them draw some diagrams. We have to help them draw diagrams, and with the support of that, we have to help them. And counting and dyscalculia, we have to help them count, like giving one, like I told earlier, what we did in assessment. Give them one stick, or one bead, or one even chocolate, and then give and add one more, and tell like make them comprehend the concept, like that. Dividing it into small steps, we can help them. And the main three learning disabilities, sorry, I forgot to write it down. Three main issues or learning disabilities are dysgraphia, that is difficulty in writing, dyslexia, difficulty in reading, and third one is dyscalculia, that is difficulty in calculating. So these are the three learning disabilities. And all the things in all these learning disability and cerebral palsy, the case is taken, well taken case. That means we have to get the generals. We are not focusing on whether the child is not writing numbers, or whether the child is not writing the words, or not reading properly, and all those things we ignore, because those are common symptoms of the disease. And we have to focus on the generals, or any, if there is any etiology behind that, or any like emotional symptoms, if we can uh, get from the parents and all. Then giving importance to the generals, if we prescribe, we can correct it at the early stage itself. I think we can, up to more, in my experience, up to 80% at least we can correct it, if not completely also. So that's all from my part. Thank you. If there is any question, please feel free to ask.
Okay, thank you, Dr. Bindu, and a wonderful presentation. And we must focus on these areas, because this is the lone system of medicine which can cross the blood-brain barrier and make some transformations and transitions, especially children. What happens if they are not properly developed, or the brain development is delayed, or some problems are there, the family, the total family will collapse. The society may also lead to some problems in society. So it is socially, economically, all the way is very important. time for discussion. Those who would like to participate, please raise your hand. I think we can stop the screen sharing. Is anybody there? Then you mentioned about this, the tools, different tools used, the Wechsler's tools. So if you're doing all these things according to the standard procedure, then definitely nobody can deny that. Otherwise, the prejudiced community will always tell about that it is only not it was not a real learning disease, but some way or other it was solved. But what is more fortunate thing is that the manager of this college, so he's a cardiologist. It's the most important thing, interesting, and also he is always supporting this program. That's the most important thing. The
Can't hear Dr. Manoj.
Am I audible, Dr. Bindu? Some
Yeah.
network problems.
Yeah.
What is the success rate of this condition? Can you compare in homeopathy as well as in allopathy?
Yeah, like that is what usually it is said that if the child or if a person is having learning disability, it's very difficult to cure, or it will be lasting like lifelong. That difficulty will be there, and it can be improved, but cannot be cured at all. But I can't say that with this limited case, I can't say that we can cure it completely, but up to 80% we can give importance. Because why? Because we are focusing more on the general symptoms. We are not focusing on the learning disability. We are focusing on the individual. I think that is the main thing with neuro cases. This neurodevelopmental, not only neurodevelopmental, neuro cases, if we are focusing on the person, we can improve. If we are focusing on the disease, only the symptoms will be palliated or suppressed for some time. That is my experience.
As you mentioned about this well-taken case, I think just that Dr. Elizabeth, well-taken cases half cured, I think. Then the two cases, only the first two cases, the carcinosis 2 cases, then staphylococcus, then pulsatilla, another one, the changeability, that is also the another symptom. So that is the most important thing. Then again, the cost of treatment is also an interesting thing. Am I right, Dr. Bindu?
Yeah, the etiology is important because in one case from in Canada, that is autism case. In that case, I prescribed arnica only because some issue with some robbers rushed in the house, and some issue with that, and the mother was at that time 9 months of pregnancy, and suddenly this issue robbers came in and made all the like robbery has been done, and she got stuck, sudden shock, and in that shock the day itself she delivered the baby. So based on that only I prescribed arnica and the child improved. So that these history taking and the generals is important. We may think that the child, we can't get the symptoms from the patient because they are not expressive, but the observational symptoms and from the bystanders or the caretakers, if we inquire the case in detail, like asking each and every minute details from the parents, we have to support them in observing and taking the symptoms. Then only, because in case of like Varatramal, frequently like I got Varatramal, the sweating will be more on the nose and the upper lip, that the parents may not be noticing it. But if we tell them that whether you have noticed where the child sweats more, any part of the body you feel that the sweat is more, then the parents will think. And also in case of these kids like in cerebral palsy, autism and all, we think that the child will not express, no, because they are having some comprehension difficulties, and they are not expressive. Autism, no expressive languages also. But we have to tell the parents on giving which food the child takes without forcing. Then they will say that on seeing like the salt, they will automatically they open the can themselves and bottle they will lick and all. So that indicates that the child is having this craving for salt. Similarly, if a phosphorus child, we know that in autism, the phosphorus child, the child is reluctant to go in a crowd. So that is a common symptom of autism. Autistic children will not sit in a group or they won't interact with other persons. But if we see a child, autistic child, even though he is not interacting with others, but he's going and sitting in between the crowd, or sitting when the guests come home and he's sitting beside them. Even in his own world, he is sitting beside them. That is a rare, uncommon, peculiar symptom. So like that, we can easily we can assess the uncommon, rare, or general symptoms.
Yes, observation is very important, as well as this aspect make homeopathy the most simple and practical system of medicine. From injury, from trauma, mental trauma, physical trauma, who can capitalize on that? Only homeopathy. This simple
And
medicine.
Dr. Manoj, let me say that now we are interacting like our cases. We are having one research group having an MOU with our college, that is in the University for Center, in the University Center for Biomedical Research. They are collecting blood group, because in this forum, let me tell that like they have collected, they are collecting blood from the autistic kids we are treating, and I am treating, and they find some important markers uh, in those kids who are taking homeopathic medicine only. I can't reveal that because they are waiting for publication. So
Yes.
in almost 60 cases, around 60 cases they have taken, and these 60 cases, those who have taken homeopathic medicine show some biomolecular changes, and that they are lacking in the other children who are not homeopathic, taking homeopathic medicine. And so they are also surprised, and we are in the way of publication. So that is a
Yes.
very good scientific change that we are bringing. And the thing is that all these kits are not given in the same medicine, only based on the single medicine, based on the generals I am giving. And all are having, like many of them are having different medicine. So not a single medicine is for indicated for autism. That again proves our principle. So I am happy
Yes,
to announce
there
this
is
in
no
this
doubt of
forum.
that. Yes. Even after 200 years, it is solid. Now, Dr. Ram Parveshra, I think he's very happy to, yes, sir, to communicate. Yes, sir, please. Yeah.
Thank you, Dr. Manoj ji, and congratulations, Dr. Bindu VR Madam. Very nice presentation. Neurological disorders case, very good selection of remedy. Pulsatilla, carcinogen. According to law of homeopathic, totality of symptom, but merit of single remedy.
Yes, sir.
Pulsatilla. Very, very thanks. And neurological disorders, homeopathic is a very good action. Homeopathic, according to homeopathic medicine, action of nervous system, tongue,
Yeah.
nervous system, and harmonial electrical disturbance, then harmonial disturbance. Teach the homeopathic medicine the very good action and marvelous treatment neurological disorder. Very, very thanks, Bindu
Thanks.
Madam.
Thanks.
Thank you.
Thank you, sir, for your intervention. Now, Dr. Norlisa. Dr. Norlisa, what is your opinion? Are you there? Also not responding. Dr. Dhanesh, the backbone of this IFPH Zoom session, Dr. Dhanesh.
Yes, really an excellent session, Dr. Bindu Mad. We really need this kind of presentations so that those who are not aware of the whole scope of homeopathy in all those kinds, particularly the cerebral palsy, ADHD, learning disability, all these areas, we can do a great role and we can make them back to health. Not only the patient, but the family will be happy. Last 2 days back, another doctor presented a case of autism, and the subject of her subject itself was saving a mother from suicide. It is not, she never wrote as a case of autism, but instead the subject was like that. That means that what we are dealing with is almost all these cases are supposed to be at the other side, that they are supposed to end up with tragedies, but either the not the patient, but the bystanders. But since they use homeopathy for this kind of diseases in the last stage, still they get result. We were able to give some result, and that's what you showed in this case also. Anyway,
Yes.
we need this kind of presentations, and we need to share all these things to public also. Then only they will
Yes,
be.
that's an important aspect. Immediately you should publish it in newspapers. Otherwise, the public don't interested or they will not believe it. What is more needed is more media communication, publication is needed in homeopathy, I think. Then definitely, as Dr. Ganesh said, it saved a life. That may be the reason Hanuman described homeopathy as the greatest gift of God. Ganesh.
Exactly. That's what we are, almost all of us are delivering to the public also. Because when a patient comes to our clinic, he may be coming for some other purpose. But when we take the case in detail, we may find that these are the things that make the person sick. And then we can say, we can ask them, you may try to bring the patient to us so that we can do something for your child. And so both the mother as well as the parents as well as the child can be saved with homeopathy.
Sir, one more thing to add, like
Yes, please.
because now we always hear that early intervention is always better and all. So I have a request to all our fellow doctors: don't hesitate if the child or the person is above 20 years also. You can go ahead with our medicine can bring a marvelous result. Because we recently had in our college one person, like one 21-year-old boy was admitted and took homeopathic medicine and therapy from Telangana. They stayed 1 month and they stayed there and took medicine and treatment, and he improved a lot. So I have a request that don't think that only below 5 years, as others say, all the other therapy and treatment are restricted to early intervention, that is below 5 years. But don't think that only if the child or the person is above 5 years, we can't do anything. Don't think that, go ahead. Whatever may be the age, we have homeopathic medicine with us. And if
Yes.
we apply in the right direction, we can bring them back. And
Yes.
we can
Sky is
help
the
them
only
to
limit.
live their life.
Yes, sky
Thank
is the
you.
Lord limit. Yes. That is then I saw that patient when I came there. Isn't it, Dr. Bindu?
Yeah.
Yes. The mothers are very happy. The parents are very happy. Very nice to see all these fellows. They are waiting for homeopathy after traveling thousands of kilometers. That's the most important thing. As then again, the hard work that we must appreciate this fellow, Dr. Bindu. They are doing a lot of wonderful work. Our young doctors, I think, more promising than the older one, I think. We always say old is gold, but this is the younger one is gold, I think. We must correct it in homeopathy. We saw a lot of our Guru Giran doctors, so many persons, recent years, last 4 years, Dr. Ganesh.
Exactly. We have seen lot of presentation from doctors in the age between 30 to 40 or 30 to 45, doing excellent work to promote homeopathy. Not only to promote homeopathy, they are getting result with the classical homeopathy. And all the presentations were really thrilling, I must say.
Or the yes. Also, the department, the National Ayush Mission is conducting series of medical camps in all over Kerala. It's focused on the geriatrics. That means 1100 medical camps all over Kerala in 2 weeks, that too. So we can calculate how much it reaches the common man. So the government systems are working very hard, as well as these fellows like Dr. Bindu. But our colleges should be more active. They should have an ignited mind. Then definitely homeopathy will succeed. It will reach the number one position. This is our medicine, as Dr. Bindu said, no limit of age. It is always when you got the remedy, definitely that will work.
Exactly. We need to bring the students to the medical camps and see what is happening in outside colleges. Then that will make them more confident than what they are today.
Yes, I did invited two interns from that college also in our program. As it's time to wind up the session, may I invite Dhanesh to express sort of thanks.
Yes, exactly. A very, very good session indeed here from Dr. Bindu B.R. Doctor is a hard-working person, as Dr. Manal pointed out, and we have a contact with her, and she really responded every time positively, and she finds the suitable data. Even today, there was a problem with her laptop, just some 2 hours back, but still she managed to find it done, and that's the beauty of Dr. Bindu. Anyway, congratulations for that also, and we are very happy to say thanks to Dr. Bindu on behalf of International Forum for Promoting Homeopathy, as well as those who participate in the session, and a big kudos to Dr. Manoj to handle this session in a beautiful way also. Thank you, Dr. Bindu and all.
Yes, I am a very proud person because she's my student. That's also an important thing. Definitely, that's beyond all description when our students are performing. With that remark, let me conclude today's English edition. Hope you that will be back again tomorrow. Till then, goodbye. And Dr. Mariama going to continue the program in Malayalam.